Frequently, our patients will present with secondary disc-related disorders in their lower lumbar spine. Patients will typically demonstrate pain in a particular direction, and in this case, we're going to treat a pain-generating hypermobile L4, L5 with pain into extension. Often, when presenting with that pain-generating L4, L5 segment, they'll have a hypomobility either at L5, S1, next to the L4, 5 pain-generating segment, or a hypomobility in extension at the L3, L4 segment, next to the pain-generating L4, L5 segment. In that event, what we're going to want to do is treat the hypomobile segment next to the pain-generating hypermobile segment to take the load off that hypermobile segment. In this case, we're going to restore extension at L5, S1 next to a hypermobile L4, L5. To do this, we're first going to preposition L4, L5 and segments above to where the mobilization technique does not reproduce the patient's pain. In order to do that, we're going to flex the L4, L5 and higher segments to keep them out of extension. Now, when we perform our mobilizations, we're going to first mobilize with segmental local traction. In this case, we're going to mobilize the L5 S1 segment by producing a locally distracting movement whereby we separate the joint surfaces of L5 and S1 in a direction perpendicular to the zygapophyseal joint surfaces. To do this, we're going to use rotation. In this case, we're going to use a right rotation with this patient to separate those joint surfaces. So, when prepositioning the patient's painful segment and above, we need to take that rotation into consideration. Ultimately, the entire spine will be rotated to the right. So, to lock L4, 5 and segments above with an ultimate right rotation, we're going to want, in a flexed position, we're going to want a left side bending. Now, the segment that we're treating, by virtue of the natural lordosis, will be extended. But we're not going to preposition it in extension. We're going to preposition the segments above and then use this right rotation as the mobilization at L5, S1 and allow the side bending of the L5, S1 segment to take its natural course by virtue of the unknown coupling at that segment.